Evening. Welcome back to another edition of Dr. Twyman Ask Me Anything, helping you guys become heart attack proof since at least 2019 when I opened my practice of cardiology in St. Louis, Missouri. So hope you guys had a great weekend. I'm still in the midst of training for my Kilimanjaro adventure next year, so put a bunch of miles in this weekend. Got some enormous blisters that I'm now biohacking with some red light and some other types of hacks that I figured out. So I won't make that mistake again. So hope you guys had a better weekend than I did on that part. But lovely weekend here in St. Louis. Got a lot of good miles out at Hawn State Park. If you've never been there in Missouri, highly recommend it to go out and check out their trails. So I had some great questions tonight. We'll answer those in just a moment. A little bit of housekeeping. So for those that don't know me, welcome. I'm a board certified cardiologist and I help people not have heart attacks and strokes. Been a physician since 2002 and have had my own practice since 2019. So if you're ever potentially interested in working with us, our practice is, where you have kind of a hybrid where you come in to see us once in the visit in St. Louis. We do the non-invasive vascular testing, do a physical exam, get you all the advanced labs and genetic testing if you need it. And then the follow-up visits can be done via Zoom. If you're interested in those, we are still offering some of those deep dives, but I'm booking out many months into the future. So if you're interested, please sign up now because I don't know how long I've been doing these deep dives. There's some discussion of potentially transitioning to a membership model in 2026. So stay tuned for some of those details. For those that want more education than what I'm able to do on Instagram, I do have a school community. It's drtwyman.com/school, or if you go to the school community, skool.com, search for Dr. Twyman or Becoming Heart Attack Proof, you'll find it. So there's a free 7-day trial. Check it out if you like it. I have courses on how to read your own labs, I have courses on how to be heart attack proof, and I'm offering Ask Me Anythings at least once a month, but been doing them a little bit more frequently as we're getting the group all fired up. We've done some demos on the Connect QT blood pressure device. I've given some ideas on primary prevention for cardiovascular disease, what lipid-lowering therapies tend to work best for individuals. We'll be talking about a new product that helps with nitric oxide in that group, and then have some ideas on how to test your vascular health at home. So I have a bunch of toys that I've shown people in the past, but I'm going to consolidate those into a video. We'll talk about the Garmins, we'll talk about the Oura rings, we'll talk about the blood pressure monitors, all the things you can look at your vascular health at home. So with that being said, if you're interested, check out drtwyman.com/school, and we'll jump into the questions now. First question up tonight, how would you help an old tired heart naturally? So I don't know exactly what an old heart is. Is it biologically old or chronologically old? Your heart is mitochondria. So if your mitochondria are weak, then maybe you're older than you should be. But there's things that can be done. So your heart requires electrons. You get electrons from grounding. You get electrons from being outside in the sun and the water in your body's charged separated by the sun. This is also the reason why saunas are universally beneficial in cardiovascular patients because of the infrared light. Photobiomodulation may help. CoQ10 if you're deficient. And then there's a whole host of things, depending on what your biomarkers show, can potentially help the mitochondrial function in the heart. Next question, is it possible to repair scars on the heart caused by troponin? So the troponin will not cause a scar. Troponin is a protein inside of heart cells. If a heart cell dies because of an infarction, so the heart attack occurs, the heart cells don't get oxygen and nutrients, they die. And the heart cells rupture. Think of a balloon popping. All the components inside the myocytes spill out into the bloodstream. And one of those proteins is troponin. That's one of the labs that we would look at to determine if somebody was having a heart attack, because troponin is not supposed to be in your blood at high levels. So if you had a peak of troponin and then a decrease, and you had generally a good story, and you also had EKG changes, then that was consistent with a myocardial infarction. So if somebody has an ischemic cardiomyopathy, or they've had an infarct that caused a scar in the heart, there can be more arrhythmias that occur in those individuals. Some of those patients require antiarrhythmic therapies. Very rarely do they need a ablation for VT, but there are things that can be done to promote myocardial function. But guideline-directed therapy would be beta blockers, ACE inhibitors, spironolactone, and then generally one of the SGL2 inhibitors. I think this was a 2-point question. The next question was about the actual value. So what Lp(a)2 activity would you like to see on a healthy 33-year-old man? So Lp(a)2 is an enzyme that when it is elevated can indicate vascular inflammation. As cholesterol particles get deposited into the lining of the arteries, the monocytes basically gobble up the cholesterol, and this enzyme Lp(a)2 activity gets released. So higher levels indicate vascular inflammation in many individuals. So there's different labs that have cut points. So in your case, you said that you had 109 and this was lower than the cut point. So as long as it's lower than the cut point, that's where you want it to be. Most labs will color coordinated. So if it's in the green zone, green is good. Lp(a)2 is very important for people who have lipoprotein (a). It's one of the enzymes that you can monitor to see is Lp(a) potentially inflaming your arteries. If somebody has high Lp(a)2 and you check a carotid intimal medial thickness scan, oftentimes you will see the intima thickened as a marker that there's ongoing vascular inflammation. Are we exposed to high non-native EMF during long plane flights? Absolutely you are. You're exposed to cosmic radiation. You're exposed to everybody else's cell phone radiation. You know, most people have their earbuds in. They got their Bluetooth headsets. They have their computers, their iPhones, their tablets all connected to the onboard Wi-Fi. You're in a metal tube flying, hundreds of miles an hour, 30,000 feet above the Earth's surface, closer to the sun than anywhere else. So yes, you're exposed to a lot of EMFs during flights. This is why you're often very dehydrated on the other side. So hydrate up well. And this is one of the cases where if you have very poor mitochondrial function, this is why flights usually will wipe those people out, because it significantly causes oxidative stress and inflammation in those individuals. It's also likely one of the reasons why flight attendants and pilots have an increased risk of autoimmune conditions and cancers. Next question, could I explain the relationship between anemia and heart disease? So anemia is you do not have enough red blood cells. So the thing I learned in medical school from one of my attendings is make them, break them, or lose them. Do you have an issue making red blood cells? Do you lack iron? Do you lack B12? Do you lack folate? Are you breaking them? Do you have a mechanical heart valve? Do you have something else in your body that is popping your red blood cells? You would know that by looking at lactate dehydrogenase and red and bilirubin in your blood. And then are you losing them? So most people lose blood through their bowels or bladder. These are the most common reasons why. So figure out why the person is anemic. But if somebody's anemic, then there's a risk that you're going to have angina if you have coronary artery disease. If you don't have enough red blood cells carrying oxygen through the system, and you have a fixed stenosis in your coronary arteries, and you go out there for a run, you may start developing chest pain symptoms because you don't have enough oxygen being delivered to the myocardium. So that is the main association. Patients with heart failure also tend to have worse outcomes if they're chronically anemic, because it often means they have cardiorenal syndrome. Their kidneys aren't working as well. The kidneys are what release epigen that releases red blood cells. So there is a connection, but typically do the workup to figure out why you're anemic. Make them, break them, or lose them. And then the question, is a photon CT scan better than a cardiac MRI? Not necessarily. It depends on what you're looking for. So if you're looking for coronary artery disease, the CT scan is better than an MRI. If you're looking for valvular disease, you're looking for myocarditis, you're looking for right-sided heart function, then an MRI is better. So MRI is better for structure. CT scans are better for coronary arteries. And then somebody's asking some questions in the comments. Can arterosil, which is a endothelial glycocalyx promoting supplement, be taken for a duration, then intermittently or every other day forever? So test, don't guess is always the motto. So if you're cutting back because the supplement is expensive for you, then make sure that your blood pressure remains normal. If you have access to pulse wave velocity technology, there are home monitors where you put it on your finger that can tell you how stiff your arteries are. If your arteries are getting stiffer, then if you want the benefit, generally you would have to take it every day. The prescribed dose is generally 1 tablet twice a day, but I've seen patients get some benefit taking 1 tab a day or every other day, but they have to test to make sure that their arteries are staying elastic and blood pressure normal on that regimen. All right, so we'll wait for some more questions to roll in. So welcome to those that are joining. So my YouTube channel, I just was able to fix some of it this afternoon. There was an issue with the way Jim and I was summarizing some of the videos. So now all my prior September Instagram lives are archived there. There's summaries of every question that's asked in the description, and the transcripts are available as well on the YouTube channel. The YouTube channel is just drtwyman.tv, or if you go to YouTube, it's just my name spelled like that, DRTWYMAN. My longer form videos and some of my videos on nutrition and how to read labs, a lot of those are going to initially be in my school community because that's where I like to teach people. I can have a little bit more kind of open hours there at times than I can on Instagram. So if you want more education than what Instagram is allowing you to get, then check out my school community potentially. All right, so we have a question, how to repair mitochondria. The first thing is do no harm, find out what is damaging them if possible. And then it's the, three-legged stool that Dr. Cruz talks about, light, water, magnetism. So optimize your light environments. Circadian biology, so don't miss a sunrise. Protect your eyes when you're inside using technology. You can use photobiomodulation. You can use sauna therapy as augmentation to add light to your system, but you always want to use sunlight as the primary. There's no better alternative than sunlight. The water is more about the water that your body produces than it is you drink, but you want to avoid fluorinated water. You want to avoid heavy metals and plastics in your water. So ideally drink water out of glass bottles or run it through filters that strip out the plastics and the fluoride in your water. Then the cold part, that is more about magnetism. That's probably a talk for another day. But cold thermogenesis, if you go back in some of my archives, I've done some talks with Navy SEALs about how to do cold exposure therapy. It is something you got to kind of work your way into. But light, water, magnetism are the shorthand ways to do it. But anything that optimizes electron flow is what you want to do. So this is why grounding is important. This is why sun exposure on your surfaces, your photoelectric, the water in your body absorbs the photonic energy from the sun. So start there and figure out what might be damaging the mitochondria. And the question is, a CT photon scan used to diagnose microvascular dysfunction? I have not seen any protocols from a photon scan being able to do that. Microvascular dysfunction is generally diagnosed either in a cath lab with pressure wires and adenosine and acetylcholine, or you can diagnose it non-invasively with an endopat scan. There are some biomarkers that can give you ideas if there's going to be issues with microvascular dysfunction, but I have not seen any protocols where CT scans see microvascular. CT scans are more for macrovascular, the large epicardial coronary artery diseases. What are some kidney saving strategies if you have high blood pressure and a degree of kidney dysfunction aside from managing high blood pressure? So ideally, the central blood pressure is less than 120 millimeters of mercury. The Connect QT device is the only home device that I know that can check the central blood pressure. So when you say managing high blood pressure, you need to make sure the central blood pressure is actually optimal. Certain medicines only lower blood pressure in your arm. Those would be the beta blockers and some of the diuretics. The central blood pressure is lowered by ACE inhibitors, angiotensin receptor blockers, which are first-line therapy for people with kidney dysfunction, and the calcium channel blockers. Then it depends on the degree of renal insufficiency. At a certain level, you may have to consider protein restriction, but not until the GFR is generally under 15. And then wanting to optimize nitric oxide, get more oxygen and blood flow into the kidneys, allow the waste products to be managed better. So nitric oxide promoting supplements on occasion, endothelial glycocalyx promoting supplements often, and then figure out what else is driving the kidney dysfunction other than high blood pressure. But make sure you're checking the right test. Look at Cystatin C more than just creatinine, because creatinine can be impacted by muscle mass and supplemental creatine. Look at SDMA, symmetric dimethylarginine. If those levels are high, often have low nitric oxide and poor renal perfusion. And then how much microalbuminuria do you have? If you have a lot of microalbuminuria, then you have active damage to the kidneys going on. And the question, any benefits to drinking or bathing in hydrogen water? Possibly, but it depends on what the base water is that created the hydrogen water. So if it's deuterium depleted, then possibly. If it's not, or you don't know, then unknown. You might be adding deuterium to your system and affecting the way the mitochondria produce energy. Deuterium is heavy hydrogen and it slows down ATP production in the fifth cytochrome. All right. Well, I don't see any other questions coming in tonight. Every Monday, 6 p.m. Central Time, I'm on here live answering your questions. The morning of Monday, I put into my story the box that you can enter any questions ahead of time. If we still have time after answering those questions, then I will answer the questions in the comments. That's the best way to reach me, but those are just one-off questions. If you're interested in doing kind of a more back and forth question, the school community is a good way to do that. And if people are willing to come to St. Louis, my team will do the deep dive. We'll spend over 2 hours with you and get to the root causes of all your cardiovascular concerns. So I see one other question. I'll answer this one, and then I'll let you go for tonight, and hope you guys have a great week, and then I'll see you back next Monday. So the last question for tonight, person said they had a calcium score of 212, so then they had a CIMT, and it was very mild with a vascular age of 47. What are the thoughts? So a CT coronary calcium score test is a risk stratifier. So a score of 0 is normal, over 400 is high risk, over 1,000 is very high risk of a cardiac event, and then the highest score I've seen is over 7,000. But it depends on at what age the person has a calcium score of 212. If you're in your 40s or 50s, that is very high risk. If you're 80 years old, that's average and not unexpected. The CIMT gives you an idea if you have vascular inflammation and looks at more soft plaque. So there's about an 80% correlation with what goes on in the carotid arteries, the arteries in your neck, and what's going on in your heart. So if your IMT is good, then maybe this calcium score test is old and you're taking care of the major risk factors of why you're developing the plaque. Got to keep nitric oxide levels optimal, keep oxidative stress and inflammation low. That's blood testing to confirm that. And then if you have dyslipidemia, use whatever combination of lifestyle interventions, medications, or supplements to control your lipoprotein levels that yourself and your doctor agreed to. So there can be some correlation that, for arterial age of 47, if you're biologically 47, is a good sign, but a calcium score of 212 at that age would be a very high-risk finding. So if you need more help and you're not working with us, talk to your doctor or talk to my team. So hope you guys have a great week, and I'll see you next Monday, 6 p.m. Central Time. If you're part of my school community, 1 p.m. Friday, we'll be doing an hour-long AMA, back and forth type of questions. So have a great week, guys.